Hi, I'm Donna Brown. I'm one of the lactation consultants here at University of Colorado Hospital Anschutz campus, and I'm going to show you how to use the Symphony Breast Pump for your baby. Before you start pumping, it's a good idea to wash your hands and make sure that your pump parts are clean from the last pumping. First, you're going to take your tubing and discs out of the kit. We're going to depress this button on the top of the pump and lift the lid gently, and then you're going to place the caps on top of the diaphragms in the pump with the tubing coming out of the little grooves on the side here. Then gently close the lid, and then your pump is ready to go. If you want to, you can do a little bit of lubrication on the nipple first with some lanolin, just so that the pump flange will slide smoothly. Just make sure the nipple is centered very well in the flange so that it's not going to rub on the sides of the flange and cause irritation. The button on the left is the on-off switch. You can turn it on. When you turn the pump on, it's going to be in letdown mode, and that is going to be for the first 2 minutes. Stimulates the milk production by a stimulating hormone. That is going to be indicated by the droplet icons going across the front of the pump here. So the first 2 minutes of pumping is the letdown phase of the pump. The pump's going to pump a little bit faster. It's stimulating hormone production. And then eventually we'll see letdown and the milk will start flowing. Now the milk's starting to let down on the right, and probably on the left in a second. The pump after 2 minutes is automatically going to switch into regular mode or expression mode. So when you're in the expression mode, you will no longer see the droplet icons. You'll see the rectangle icons going across the screen. And again, to tell how strong your suction is, you can adjust it with this dial, and however far across the icons go, that's how strong your suction is. The middle dial, which is how strong the suction is, and turning it clockwise will increase your suction, moving the icon this way. Turning it counterclockwise will decrease your suction. And if you start letting down before then, you can switch the pump. There are different size flanges, the part that fits over your nipple. So if there's any question about how that's fitting, we'll want one of the nurses to look at it and help make sure you have the right size that's not too small for you and causing you any additional discomfort. So we don't expect pumping to ever be painful for you, but some moms may need to get used to the sensation of pumping. And so at first it may feel a little tender when you first start pumping. We don't ever want the tissue to start to look irritated. Usually the length of a pumping is around 15 minutes. However, you can go a little bit longer if you notice that you're still having milk flow. And sometimes when your milk flow has stopped, it's possible that another letdown will be triggered and you'll see flow increase again. So you can pump a little longer. We don't usually recommend longer than 20, maybe 30 minutes at the most. When you're removing the flanges at the end of pumping, just gently break the suction so that you don't pull them off with a vacuum still intact.